Hello and welcome to On Call with the Prairie Doc After Hours. We had many great questions submitted beyond what we could answer during the broadcast portion of our show, so let's get started. Thank you for staying overtime.
Absolutely.
We'll pay you double.
Okay, wow.
A woman from Laverne, Minnesota asked if the early stages of ALS, amyotrophic lateral sclerosis, Lou Gehrig's disease, it can be confused with stroke symptoms.
Well, the weakness and sometimes
speech
changes too, the slurring that can happen with ALS. It could, if somebody had a stroke already, you might have trouble telling them apart just on the street. But ALS is a slow, progressive process. So really, very different than a stroke, which happens, so suddenly. So.
Okay, so it should be evident, but if you're having symptoms of ALS and somebody calls it ALS, it's ALS.
Yeah, I think it's, if you see a specialist, and it's not going to be similar in that regard.
A Rapid City woman says, my husband had a stroke a year ago. We were told about a device being inserted into the right atrium. Watchman, does it prevent clots in the right atrium?
It doesn't directly prevent clots, but it can keep the heart, the goal is to keep the heart beating in rhythm, and if it's not going to beat in rhythm, then know that, and then put, start medications to thin the blood, like Coumadin or Eliquis. So. And
there's sometimes a hole in the heart where people, let's face it, the final filter of blood clots that form in our body, and there are blood clots that form in normal people's body. Mm-hmm. It goes into the right atrium, right ventricle, through the lung, and the lung says, nope, you're not going anywhere, and will protect the rest of the body. Tiny clots happening like that a lot. But if you have a hole in the heart, sometimes that clot can flip through to the left side and then flip to the brain, and that's why they sometimes want to put a patch between the atrium to prevent clots when people have clots. A Tyndall man is wondering about an occasional whooshing sound in his ear. Oh, that's a great med student question.
Yeah.
His blood pressure is normal, and his doctor thinks it could maybe be a blood vessel close to the eardrum. What's your opinion, and what really could it mean that there's a possible stroke coming?
Well, the whooshing sound is pretty common, so I can't say that that's just the artery, just here in the chair, But whooshing sounds that can become louder or change, that come along with headaches. There's some other things to think about and look into, and certainly if it's persistent and there are things we can do to look at the arteries of the head. Not everybody needs those studies. I mean, there's risk associated with all the diagnostic studies. So a common sound in the ear, I think I just watch it and not worry about it too much unless other things happened with that.
So I've had maybe 3 that I've discovered in my practice. One was an AV malformation in the brain, and another was, 2 of them were carotid obstructions, but the carotid obstructions were not severe enough to do anything. Actually, one was a carotid and one was a posterior
vertebral
artery circulation problem. A Sioux Falls woman says, I was put on a blood thinner and a baby aspirin. Doctor wants to take me off the blood thinner. Is that normal?
Yeah, I mean, in the appropriate clinical context, these blood thinners have risk too. And fall and bleeding in the brain from hitting your head too hard, or bleeding in the stomach. I mean, those can be life-threatening, certainly. And so if you don't need the blood thinner and your doctor determines it's safer to be off of it, you should get off of it.
So I had a woman with chronic atrial fib. I had her on warfarin. She was perfectly balanced, anticoagulated, and she went boom, 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 down the stairs.
Yeah.
She had the biggest bruise of a head and neck I've ever seen, but she didn't have a stroke from it and didn't have a subdural hematoma or anything like that. But boy, she had a bruise. I think about the risk of warfarin or Eliquis, even of aspirin, in a person who gets elderly and more frail, and falling risks occur. And particularly high blood pressure medicines, which can sometimes bring falling risks.
Right.
So medicines you got to be balancing risks with them.
If they were safe, they'd be over the counter. but
Yeah,
but they're not.
they're not.
We have to use them judiciously.
One viewer pondering, should a shunt be put in right away when there is a swelling around a surgical site in the head from an aneurysm? That's a challenging question. A shunt be put in, swelling around a surgical site on the head from an aneurysm. So there's an aneurysm in the brain, there's swelling. He's thinking take the pressure off the brain.
It depends on the pressure. So sometimes we do craniotomies, and so take off some of the skull to relieve pressure if that's the pressure that's the problem. If it's fluid that's being made deep in the brain
In the
that
lakes
can't
with-
get out, then we need to shunt that away because the swelling might be closing off what's called an aqueduct or a passage for water. If that aqueduct is closed, we have to shunt.
It's a very, very selective deal. You just each situation is different. There was a question: do young people or even infants ever have a stroke?
Yeah, if there's a clotting disorder, you spoke about that in elderly, in the aged population, and certainly if there's a genetic predisposition or the immune system causes clots, if there's a tear in the artery, certainly we see that with motor vehicle accidents. Somebody hits their neck hard, or it gets hyperextended. The artery will tear, and then a clot can form on the artery, or the artery wall will flip over and cause cessation of blood flow. So young people can get it.
It's bad news.
Yeah.
There was a woman who called in and asked about numbness in her left arm, and she had had stent placement for dialysis, an AV fistula, actually an AV fistula made so that you have a large vein access that you can use to give dialysis. And she has numbness in that arm. Is that a stroke?
It's possible. The most likely thing I would think about first is that there's change in the blood flow, change in pressure. Maybe a nerve is irritated from the stent or the fistula, and that might be causing the numbness in that area.
Or even cut by the surgeon who's doing it. I mean, you're diving down in there, getting an artery, putting it together with a vein. So we have a question. Jill said, I had a basal ganglion stroke about 3 years ago. What can you tell me about this type of stroke, a basal ganglia stroke?
So the other, I talk a lot about the clots that come from an artery, and the other kind of stroke is in the brain, and it's a small artery that just sort of closes off, similar to what your mother had, and that closing off from the artery that happens a lot in the basal ganglia. It's called small artery disease or small artery stroke, and that's the small artery stroke generally it's smaller. But the basal ganglia is very important for movement and speech too can be affected, and so I think people make a better recovery after a small and basal ganglia, but it doesn't guarantee they're going to be back to normal.
But they have these strange crossover symptoms. One side versus the other. There's this unusual kind of neurologic presentation with people with basal ganglion stroke, and I've had one of those in my whole experience. That was a basal ganglion, obviously with this myriad of symptoms.
Yep, they're crossover syndromes.
Yeah. I'm a 72-year-old woman from Hudson, South Dakota. I don't know where Hudson is. Do you?
I don't recall.
I had an AFib attack a year ago and was put on Eliquis at that time. I'm taking high blood pressure medicines for around 5 years. Are my risks for stroke reduced, or am I still a target candidate?
Well, certainly with medications,
reduce your risk of stroke
from a lot. So, the numbers I remember from training, 15% per year in people, and most people with atrial fibrillation, and medications will bring that down to 2% per year, which is a huge reduction in risk. And so, but then again, as we age, that increases, and so it's can't say that somebody on treatment will never have another stroke. It's just much less risk of having one.
One viewer is feeling numbness in her left arm, went to the ER. Oh, that was asked. A man from Selby is wondering, what is the difference between a CTA and an angiogram? CT angiogram,
Yep.
and a regular angiogram, and also should people with carotid disease be taking statins?
So an angiogram is really, I mean, it's just a picture of an artery. And there's different ways to get that picture. One is a CT angiogram. You can do MRI or MR angiograms. You can do conventional angiograms, and that's where we kind of go in the leg or go in an arm and inject dye into the arteries and do an x-ray. And so a CT angiogram is fast, it's very good, and...
Is it as good as a standard angiogram?
Oh, in what measure of good, you know? So conventional angiograms are better for AVMs and different malformations. They're good to see in real time what's happening across a narrowing. A CT angiogram can really look at the whole branch, all the branches of arteries, and say, you know, that here's a blockage, and we know that right away. The patient doesn't have to have a big hematoma in their leg, or, you know, or any
Side effects of the standard.
yeah, of the big procedure. I mean, it's a big procedure to go thread the catheter into the leg. So a CT angiogram is probably safer in many ways.
And for the final coup de grace,
Okay.
Susan Wright, I love this, wrote in concerning the Bible verse citing the New King James Version, Samuel 25, 1 Samuel 25, 37 to 38, when his Nabal's wife told him these things, that his heart died within him, and he became like stone. Then it happened, after about 10 days, that the Lord struck Nabal, and he died. The
There
stroke.
you go. Thank
That's
you
wonderful.
for that. Yeah.
1
yeah.
Samuel 25, 37 to 38. Thank you for that. Well, thank you all for joining us on our Facebook page. We appreciate all of your questions and the opportunity to answer them. And until next time, from all of us at On Call with the Prairie Doc, stay healthy out there, people.